Fullness in the lower eyelid, or what many people refer to as bags or eye bags, can be addressed through a lower eyelid blepharoplasty. Bleph means eyelid, plasty to change the shape or form of by taking out some redundant skin or tissue, as well as debulking fat that causes the fullness in the lower lid. Bags are not because we gain fat around our eyes. We all have fat around our eyes. But what happens as we age is a membrane that holds that fat in place, called the septum, stretches out, causing the fat to be visualized underneath the skin surface. This can be approached through two fashions. One is internally, or through the inside of the eyelid, and this is typically employed in younger individuals who lack redundancy of their skin. As patients age, however, their skin becomes more loose, lax, and they develop lines or wrinkles. If we just went internally for a blepharoplasty in a patient in that age range, they would be trading in the fullness in their lower lid for redundant skin. For that reason, we typically recommend an external approach in older individuals where we make the incision below the lash line and extend it out into a smile line or a crow's foot line. The steps on a blepharoplasty include first making the incision, opening the septal membrane, taking out the nasal, central, and temporal fat pads down to the level of the orbital rib. We don't go beyond that because if we did, they could actually look hollow, and we want to avoid that. We then tighten up the septal membrane with some cautery, tighten up the lower lid to avoid a downward turned eyelid, or what's referred to as an ectropion, and as a final step of the process, take out a small amount of excess eyelid skin and close the incision with dissolvable stitches.